Hello and welcome back to our Dermatology Updates series. Today we are diving into episode 3, which includes the most recent research and breakthroughs in the field. We will look at a variety of dermatology topics, including a compelling study linking perimenopause and rosacea, and the most recent research into alopecia areata. We will also discuss Zoryve foam, a promising solution for patients with seborrheic dermatitis, and Orismilast, a potentially game-changing treatment for hidradenitis suppurativa. Finally, we will take a deep dive into Tapinarof cream, a highly effective and safe treatment for adult psoriasis that has recently gained popularity. Each of these topics advances our understanding and treatment of various skin conditions, so buckle up and prepare to be enlightened. Stay tuned as we delve into these exciting advancements. First, let us discuss a recent study. Scientists at West China Hospital investigated the relationship between perimenopause, estrogen levels, and rosacea. They discovered some interesting topics worth discussing. They found that hormonal changes, particularly lower estrogen levels, are linked to rosacea in middle-aged women going through perimenopause. This is important because rosacea can really affect how people live, making them feel more anxious or sad. It has a big impact on their quality of life. The study discovered that when estrogen levels are lower, the symptoms of rosacea become more severe. This suggests that estrogen might have a protective role in preventing severe rosacea symptoms. The study also says that when estrogen levels drop during menopause, it might be one reason why more perimenopausal women have rosacea. But the researchers know that their study has some limits, and they're asking for more research to be done to really understand this topic better. This study gives us new ideas about rosacea and might help us find new ways to treat it in the future. Now let's talk about what's happening in treating alopecia areata. This condition affects people of all ages and can be tough, especially in severe cases. So it's important for the medical community to focus on finding effective treatments. Scientists are now looking into Janus kinase or JK inhibitors as a promising way to treat alopecia areata. These studies show that it's really important to make sure the diagnosis is certain and the evaluation is accurate before and during treatment to get the best results. Even though we've learned a lot about treating alopecia areata, these studies remind us that it's crucial to keep researching and learning more in this area. Now let's turn our attention to Zoryve foam, also known as Rosacea, a promising treatment for seborrheic dermatitis. This new treatment, which is a PDE4 blocker, has worked really well, especially for people who can't use the usual topical steroids. Surprisingly, Zoryve foam has achieved 3.5 times higher clearance compared to its vehicle. But what makes Zoryve foam truly stand out is its impact on patients' quality of life. Additionally, Zoryve foam is safe to use, which means it's a good and reliable choice for many people. Almost 78% of patients aged 12 and older had less itching within 24 hours of using it for the first time. Zoryve foam represents a significant improvement in the treatment of seborrheic dermatitis. It not only relieves itching quickly but is also completely safe to use. Now, let us discuss a study to see how well Orismilast works for treating hidradenitis suppurativa. This interesting study looked into how well people can tolerate and how effective Orismilast is in treating this chronic skin condition. It's an oral medicine that works as a phosphodiesterase 4 inhibitor. While the results were hopeful, there were some difficulties and challenges in the study. The most challenging issue was the gastrointestinal side effects. But it's important to mention that people who finished the treatment had significantly fewer skin issues compared to those who stopped the treatment. This suggests a potential positive correlation between the use of Orismilast and the improvement of hidradenitis suppurativa symptoms. However, it needs to be proven through further research. To summarize, despite some limitations, this study suggests that Orismilast could be beneficial in the treatment of hidradenitis suppurativa. Now let's talk about a new study on how well 1% Tapinarof cream works for adult psoriasis. Dr. Lillian Sun led this important study with over 2,400 patients involved in 8 clinical studies. And guess what? The results were really impressive. Tapinarof cream, also known as VTAMA cream, performed better than placebo and another psoriasis medication, calcipotriol, after 4, 8, and 12 weeks. This represents a significant advancement in the treatment of psoriasis. In terms of safety, while there were a few more side effects than with the other medicine, there were no major issues overall. So it appears that Tapinarof cream is safe to use. To summarize, this cream is not only effective but also safe to use for an extended period of time. The study suggests a new and promising treatment for people suffering from psoriasis. Tapinarof cream, with its strong effectiveness and safety, offers a new option for psoriasis patients. That's it for our third episode of Dermatology Updates. Today we talked about many things, like the connection between rosacea and estrogen levels in women going through perimenopause. We also discussed exciting research about using Janus kinase inhibitors to treat alopecia areata. We also looked into how well Zoryve foam works for people dealing with seborrheic dermatitis and the possibility of Orismilast helping with HIDRADENITIS suppurativa. Finishing our discussion with how Tapinarof cream helps adults with psoriasis, it's evident that dermatology is always changing and getting better. These studies highlight how important it is to keep researching. It's crucial for us to learn more and better deal with different skin problems. These studies take us a bit closer to making life better for many people dealing with these skin conditions. Thank you for joining us today. We look forward to providing you with more updates in the future. If you find this content useful, please consider subscribing to the channel.